Well, President Cyril Ramaphosa will address the nation shortly, and in fact, in about 27 minutes or so. We've got senior lecturer from Wits University joining us, Dr. Lumkile Mondi, just to unpack exactly what we can expect ahead of that address at 8 o'clock. Doctor, thank you so much for joining us this evening. I mean, one would say that the president is walking quite a tight rope, balancing livelihoods from lives. And unfortunately, now that we're faced with the third wave, this third wave is much more severe as we anticipated. Was government prepared enough for what is to come?
So, firstly, it's quite important for us to remember that government really, from the last week of March 2020, put quite a lot of effort by locking down the economy and building infrastructure in case of what is expected to be really a calamity for South Africa and its own people. And we know that those led to really excellent intervention. So, therefore, those interventions were not accompanied by acquisition of vaccines, which in fact could have really put us in a much stronger position that we saw in the later part of the year, when there was economic recovery and as well as in the first quarter, where today our infrastructure is much weaker. So all the infrastructure that we invested in that last week of March onwards has all but collapsed. We know that here in Gauteng, the one at Nasrec is not open, despite all the infrastructure investment that was put in. We also know that we had to put a fight at Wits to persuade government to open Charlotte Maxeke so that we can have more beds and more access to support those that are infected. So really, government has let us down by not completing the puzzle. The completion of puzzle would have meant that as you lock down on level 5, you then go and acquire as many vaccines as possible so that this crisis was addressed, and today we can open up, as we've seen, what's happening in the Americas as well as in Europe.
Yeah, it seems like a dream to us, though, isn't it? Let's talk about the economic impact of stricter measures, especially in industries like the restaurant industry as well as the liquor industry. They are saying that there will be job losses and they simply can't afford another hard lockdown.
Well, I mean, we saw that a number of restaurants have not even reopened since they closed down in the lockdown last year. So it's been very, very hard for the labor-intensive sectors in the restaurant, hospitality, as well as tourism industry, broadly speaking. As far as the shebins are concerned, the real challenge there, where they're affected, is basically that when we've got a hard lockdown, those that are in that sector don't have clientele coming in to enjoy the wonderful drink that they so much work for and therefore are willing to purchase. So they also get hit. So really, a lockdown hit those small, medium and micro enterprises at the periphery, because those that are earning income in the formal sector are not working as we expect them due to the lockdown. So South Africa cannot afford any huge lockdown. What you can do is to impose more restriction on movement, specifically maybe closing in on what we call curfew hours, to ensure that there's more people indoors than we have at the moment in the current lockdown.
Well, Dr. Mondi, you're saying that South Africa can simply not afford any more stricter lockdown measures, but surely South Africa can also no longer afford any more corrupt officials. Now, even if we are gauging with what was said by the Auditor General, as she was just articulating how COVID-19 money meant for relief measures being put in place, I mean, in some instances went as far as ensuring that a mayor got a vehicle. So clearly, as much as government has got to walk this tightrope of preserving lives, they need to be held to account, especially where corruption is concerned. I mean, a car, instead of going to livelihoods during a pandemic, does not make sense, does it?
It doesn't. However, we need to understand South Africa in the context of what it is. South Africa is an extremely unequal society. In addition to that, there is concentration of ownership of wealth. Secondly, there's also concentration of control of the economy. Therefore, what we've seen since 1994 is that many black entrepreneurs have been trapped with government as the only source of them making a living and making income. And therefore, you'll see that a number of the black entrepreneurs, through whether the tender system or any other sources of opportunities of black entrepreneurs, have come to government because the private sector has shut down many opportunities possible. So the transformation of the economy has not happened. Therefore, what we see as corruption has benefited, in fact, mainly, widely, the very same firms that are involved in concentration. For example, we know that the banking industry were big facilitators of the corruption and outflow of capital, which is so important for us to reinvest in South Africa. And these banks were busy allowing the Guptas and many others to take the money out of the economy. So therefore, when you talk about corruption, this society of ours has got so much to do, not only with politicians who have to be made to account in October in the coming election and the next general election, but also the private sector must look at itself in the mirror, that closing opportunities for black entrepreneurs will only deepen the crisis that we have, where black entrepreneurs can only source in government, and therefore those closer to politicians will have access, and corruption will just breed itself, both from private and public sectors.
Very lastly and quickly, if you can, is there any way our government can, cushion the blow when it comes to the economic effect of tighter restrictions? Anything that they can do or measures they can put in place to make sure that businesses don't shut down this time if we're going to see a harder lockdown?
So, Sean, there's only one solution for us, is to go big on vaccines. We have to look not only on Pfizer, AstraZeneca, as well as J&J. We have to look, I know that Surprise is involved with testing Sinovac and Sputnik. So we have to think broadly that the agency for us, not so much to lock down and cut the infection. The agency for us is acquisition of vaccines. Because if we do that, then we'll make a huge impact. And then therefore, in the next 18 months, we probably might start opening up, as we've seen in Europe and America. At this juncture, the fact that we keep on using lockdown as a stick without leadership taking care of acquisition of vaccines, it means that South Africa is a long, long way to go. After Delta, we'll have another one coming in as long as we don't vaccinate. So government must rise. So the president today must tell the nation that as he addresses these measures, what steps is he taking in acquiring vaccines so that we can shorten this pandemic, and in doing so, start focusing on what matters most, which is the economy, to get people out of unemployment, address inequality and poverty, and the broader transformation of the South African economy, which still remains in a few hands, in wide hands, and the black majority have to fend in government and the process continue the corruption that we've seen since 1994.
Yeah, thank you so much for your time and insight. Appreciate it. Economist Lumkile Mondi.